Hi, I'm Amanda Beverly at ThriveWorks Roanoke. I wanted to talk with you today about trauma-focused cognitive behavioral therapy. So that's a lot of words, but what it simply means is that it's addressing trauma by exploring an individual's thoughts, feelings, and behaviors as they relate to the individual's traumatic experiences. This is traditionally developed for children and adolescents, but there's a lot of research out there that says it can be as effective for adult clients. This form of therapy is combined of various steps, but the most important part probably of trauma-focused cognitive behavioral therapy is creating a safe place for an individual to process their trauma, and by creating a trusting therapeutic relationship between the therapist and client. Some of the steps that I talked about earlier were it begins with a psychoeducational process where the client learns about the direct and indirect impacts of trauma. They learn relaxation skills such as guided imagery, deep breathing, progressive muscle relaxation, grounding techniques. Once they perfect those things, they then start creating a trauma narrative where they talk about the traumatic experiences that they have had. Through that, they process the thoughts and feelings and behaviors that are related to their trauma. And then if needed, create a behavioral management plan to help them in the future as traumatic experiences begin or resurface through other situations and events. At the end, if it's created or done with an adolescent, then we really want to focus on the family session portion at the end of the treatment that helps the parents be supportive of the child and understand what they've experienced and what they're going to need in the future to keep from having some of these symptoms related to their trauma. Some kind of cool facts about trauma-focused cognitive behavioral therapy is that it can be as creative as the client wants it to be, which can be fun, and keep it interesting. It can be modified to be developmentally appropriate for any age or any intellectual level of the client. It's been rated as a model program, best practice and evidence-based, which is always good. And it's also short-term. It can be between 8 to 25 sessions depending on the client's needs or level of trauma that they've experienced. If you want to know more about trauma-focused cognitive behavioral therapy, give me a call. Thank you.